Dizziness in the middle of exercise often scares people into thinking the worst, that they're having signs of heart problems or stroke.
But sometimes there can be a simpler reason for the symptoms. Dr. Jay Adlersberg is here with details. Jay?
Sade, Diana, it's a good idea to bring any symptoms related to exercise to the attention of your doctor. But in a quarter to a third of people, the dizziness and other symptoms in the midst of working out may be due to low blood sugar brought about by exertion. Walter Johnston's athletic passion is running, but over the past 5 years, he noticed some strange symptoms that threatened to put him on the sidelines.
As I ran, I would start to see spots in front of my eyes, and then they would come together and I would have one big hole in my vision. If I kept on running, I would start to lean or tilt to one side.
It wasn't his heart or a stroke.
Okay, Walter, you're going to feel a little pinch.
It was his blood sugar.
88.
That's perfectly normal. That's perfect.
But his treadmill test was not perfect on Mr. Johnston's first go-round. His sugar was far below normal. He was having exercise-induced hypoglycemia, a very low blood sugar that results from working out. Beth Glace is a sports nutritionist.
It seems to come about most often when somebody eats something sweet prior to exercise, shortly before exercise. Very classically, it happens about 10 to 20 minutes into exercise.
Walter's symptoms happen if he ate carbohydrates within a couple of hours of a run. Other symptoms can include lightheadedness, hunger, and cold sweats. When you eat something sweet, insulin enters the blood to stabilize the blood sugar. Some people are very sensitive to insulin, which can drop the blood sugar very low during exercise. His first treadmill test showed the low sugar just when his symptoms started, but today's test was fine. The solution was pretty simple. He stopped eating at least 4 hours before a run.
Since I've used that formula, I haven't had a single episode of the hypoglycemia, which is wonderful.
Beth Glace says it's okay to use sports drinks or other carbohydrates after the start of exercise. You and your doctor should rule out heart or blood vessel problems if you get symptoms from working out.